I'm going to go ahead and share my screen. We're going to go over the crown and bridge tray. All right. So let's get started. So of course, when we're doing a crown and bridge tray, we definitely always are going to need the basic setup, right, you guys? Okay. So of course, we're going to start with that mouth mirror explorer. What do we do with the mouth mirror? What's the purpose?
To look inside the mouth, to see if we see any cavities or any broken teeth or just anything out of the ordinary.
Awesome. So pretty much just to be able to see inside of the oral cavity, right? That's a great job, Tony. And then you have your explorer. Sharena, what is explorer for?
To like tap the teeth and to see what's decayed and right.
Right. So pretty much to examine the mouth, right?
Mhm.
Without that explorer, we wouldn't be able to determine if your patient had any carriers or whatnot, unless the tooth was broken, right? And so you pretty much in any tray, any procedure, anytime your patients come in, you are going to be using a mouth mirror and explorer. That is like mandatory. As you can see here, the air water tip is right here. It kind of slid onto the next card, but the air water tip, of course, we're going to be using that to pretty much irrigate inside the patient's mouth. It helps give you a clear visual inside of the patient's mouth, and then it helps the doctor see also. Okay, so it does, once you connect it to the host, it does send out a little air and water, as you can see. Let me kind of erase that too. It does send out a little air and water, which is, what we need, right? Next, of course, you will use your HVE. Let's see, Gabby, what is the HVE for?
Suction.
Suction. So you think with the HVE, we'll be able to only suction saliva or bodily fluids? Do you think we can suck up large particles that may fall out of the tooth?
It depends on how big, I'm assuming.
Right, good job. It does depend on how big and if it can actually fit inside of the HVE. But the HVE is meant to suction, saliva, bodily fluids. When you hear me say the word bodily fluids, that's the meaning. That's what we want to say for blood. You don't want to say blood in front of your patients because, of course, it's going to freak them out. Wouldn't if you were in my chair and I was like, man, look at this blood, you would think I'm bleeding out or freak out or something like that. So when you hear me say bodily fluids, and it's a safe word for you to also use when you're on the job, it means blood. Next, your saliva ejector is a little different than your HVE. It more so only suctions, saliva, the water that we put in the patient's mouth. Some of the blood, if the blood would be really thick, then the saliva ejector probably wouldn't suction it up. Sometimes you can get a little blood clog. It probably won't suck it up because it's too thick to go through that. I guess I can call it a straw. Cotton rolls. Who else do I have on here? Mackenzie, what is the purpose of a cotton roll?
It is used to like separate the lip or yeah, I guess the lip from the gum so you can have it like packed.
Correct. So we would actually use that to isolate the tongue or the cheek from the tooth. Does that make sense?
Yeah.
Okay. Next, we have our cotton pliers. I'm losing my voice again, you guys. Let's see. Chanel, what do we use the cotton pliers for?
To place the cotton roll in the mouth.
Drink. Yes, so we will definitely use it to place the cotton rolls or any small items inside of the mouth. Also, if we need to withdraw anything from the mouth, meaning if we have to take anything out of the mouth, that is the purpose of your cotton pliers. No, it does not do the same thing as tweezers that we pluck our eyebrows out with. It is not as sharp and it's not as firm as that tweezer. Now, anytime we're doing a crown and bridge tray, we definitely, it's going to be using this particular material right here. This is your bright registration. It's used particularly for pretty much being able to send the lab a model of how that original teeth, the teeth that's in the mouth before we cut and prep any tooth, how they align. So when you bite your teeth together, it's going to show that contact, that relation between your maxillary and your man. Now, Denasia, when you hear me say maxillary and man, that is referencing to your upper arch and your lower. So upper is max, lower is man.
Okay.
So we would definitely have to attach it to, let me get my little pointer here. So this particular tube right here, this is what we would call the registration bite. We have to connect it to the impression gun, which is right here. Okay, and then we would, you know, have the tip to be able to dispense the material on the edge, on that bite in your patient's mouth. And once we do that, we have them bite into their regular bite, and then they have to bite until the material actually gets hard. Okay, so it doesn't take very long. It takes a few seconds. So when you actually start putting it in the patient's mouth, you want to kind of move a little fast to make sure that it doesn't get hard on you. Now, when we get into the next few instruments, I like to kind of keep them together because, you know, we're going to use them together. So you have your gauze. Your gauze is what we're going to actually use before we give the patient, you know, that numbing medicine, that anesthesia. Anytime we're cutting on a tooth, you want to be able to numb your patient so they can be comfortable. So here, we're going to take the gauze, the 2x2 gauze. It's kind of like cotton form if you haven't seen gauze before. We're going to take that and we're going to dry that area where we're going to be actually giving that patient that shot. I guess I can use the word shot. Everybody's okay with that, hopefully. So we're going to dry the gingival margin. And then here, this particular instrument here, it's called the cotton tip applicator. So we're drying the tissue. We're going to put some topical right on the tip of this cotton tip. And then we're going to pretty much place it in that area. So you want to place it exactly on the gingival margin, which is the gums. If you've ever had a shot and you've tasted topical, topical smells very good, but it tastes very bad. It's almost like the same thing as your Oral-B gel that you get over the counter to be able to apply that to that area before you actually put the needle in the gingival margin. So of course, here's your syringe. And of course, we would connect that needle here. And you as an assistant would not be giving the patient the shot. Actually, it would be the doctor. So you want to have the tissue, the gingival margin dried, and you want to be able to apply that topical, let it sit for a minute. And then by the time the doctor comes in, we can go ahead and pretty much give him the shot, hand the shot to the doctor, and the doctor will give the patient the shot. Now, once the doctor is done with that shot, he is going to actually hand that syringe back to you. So you want to be careful on how you're grabbing that syringe, and we're going to have to recap it. So this is why we have this recapping device here. This recapping device actually will help you put the cap back onto the actual syringe. So I will be posting a video on how that is exactly done. So I want you guys to make sure that you watch this video and answer the question. Okay. Now, once we recap it, your cap should already be inside inside this little hole here. And that way you can pretty much have the card and just you should be able to just not, you don't even have to touch the card. You should be able to just stick your syringe inside of the cap, and then that card allows it to give it some stability to slide back on the syringe. No, not every office that you're going to work in is going to provide that recapping device, but hey, you would do it the same way. If you just had the cap, you want to just place the cap on the counter, and then you want to slide the syringe, the needle part inside of that cap. Not with both hands. No hand should actually touch the cap. It should only be, you should only use the hand that you have your syringe in, and you're only sticking it inside of the cap. So I will post a video so you can see how that is exactly done if you're not understanding what I'm saying. Next, so while that patient is, we're going to give that patient a little time to get numb, and then we're going to have to take some impressions, some alginate impressions to, you know, have models to send to the lab. You know, you want them to see the relationship between all teeth. You want them to see the shape, how many teeth, what's missing. You just want them to see everything that's in the mouth. So by us taking the alginate impression, that is going to allow the lab to really have a better understanding on the relation of the entire oral cavity. Okay, so here's your mixing bowl. You're going to go ahead and put that alginate. And if you haven't, or if you have already, I will, you know, inform you on how exactly you are going to, how much alginate. I'm sure we know we're going to put what, two scoops of alginate, or 3, depending on the size of the patient's mouth, right? So here you're going to put your alginate in the mixing bowl, your spatula, you have your measuring cup here, and your alginate scoop. So the powder goes in here. You put 2 scoops inside of the bowl, or 3, or however many you need. And your measuring cup, who remembers how the measuring cup actually works? Anybody? It better be everybody.
Wait, say that again?
Who remembers how we exactly use that measuring cup?
Oh my
Do
God.
we just fill the cup up with water, or is it
No.
a certain amount we put per scoop?
No, it's like pretty much gotta match the ratio of the powder and the water, right? That's
Yes.
the same.
Yes, very good. Now, you know how you have any measuring cup and it'll tell you if it's a half a teaspoon, half a cup, or whatever the measurements are, or 3/4 of a cup. Well, with the alginate scoop, so this whole entire scoop, you're gonna fill it with alginate, right? And you're gonna dump that inside of the bowl. Now, when it gets to your measuring, they have the little measurings on the cup, and it's probably somewhere about here. And every scoop, let's see if I can draw it to kind of give you a better idea. I'm not an artist, you guys, so just kind of bear with me. Yep, very good. All right, let me get my little pin back. So you'll see a line here, and then you'll see a line there. I think that's how that goes. All right. So what you do, every scoop, so one scoop, picture this, one scoop of this alginate, and you would fill to this line right here. So every scoop requires, you can say, a drop of water. Because it's not a very lot of water. I'm gonna kind of zoom in a little bit if it'll allow me to do that. Let's see. Yeah, here we go. Alright. I just kind of threw all my drawings off. Okay. All right. So you can kind of see it now. There's a line here. It's going to divide in 3 parts. So you're going to have 1, 2, and 3. So every scoop requires a drop of water. So you would fill up to this line right here. That would be 1 scoop. If you have 2 scoops, you'll fill up to this line. And if you have 3, you'll fill up right to the rim, just about. Not enough for it to spill, but just a little bit under the rim. And there's like a bold line there for you to see also. Okay, so that is what's going to determine if you're going to take a good impression, because you don't want it to be lumpy. You want it to be very smooth, because you're going to be putting that material inside of the patient's mouth. And I don't know about you guys, but I'm a texture person, so I wouldn't want a bunch of clumps in my mouth. Not that your patient would even know the first, right, about what's actually going in the mouth. But yeah, so once we take that impression to get those models, we're gonna proceed to, getting that tooth prep, okay? And by getting it prepped, we, first you wanna give your patient this bite block right here. Can everybody see that?
Yeah.
Is it just me and Tony here today? There we go. Give me some interaction.
No, I can see it.
Okay, awesome. All right, so great. So this particular bite block here, it is used to help the patient keep their mouth open in a safe way. Because if we are cutting inside of that patient's mouth, what will happen is, if we're cutting inside of that patient's mouth with this particular handpiece right here, this high-speed handpiece, and the patient closes down, what'll happen is we will probably, well, the doctor end up cutting the inside of the patient's mouth. So you have some patients with that struggles with, lockjaw or TMJ, and they can't keep their mouth open for long periods of time. So we would put that bite block inside to give them some type of support, okay, to keep their mouth open. So what they'll actually do is they will, you pretty much place it inside of the mouth, and the patient will bite on this side and that side. Does that make sense?
Yeah.
Okay. All right, so moving on, your high-speed handpiece here. You're gonna connect this to the unit, which will give you a hose. It'll shoot water through the head, and you'll place your burrs right here. And this high speed allows you to cut any decay, shape the tooth, to do any type of cutting you need on the actual tooth, okay? That's pretty much what that high-speed handpiece is for. So here you have a burr block here. This burr block is magnetized, and if you can see the little holes they have inside of it, this is where you would place your burrs. Your burrs are little tiny little tedious pieces, and I will post some pictures on what your burrs look like. They're little tiny cutting burrs. There are different type of burrs. They have burrs that's for polishing, burrs that are specifically for cutting. What we're doing in this procedure, that we would place in here, and it helps. It helps actually helps the patient. I mean, the doctor keep track of like all the burrs without them falling on the floor. It really works out. Okay. Now you have your perio probe. Once we finish cutting and shaping that tooth, remember I did post a video for you to see what exactly we're cutting and how. Sometimes either at the beginning of the procedure or, when they came in for the examination, we would actually have to use this probe. Let me kind of zoom in it for you so you can see. Can everyone see that? I know it's kind of silver on silver. You can't really see it, but here is a probe. Right here is what you would call a ruler, and that measures the bone in the mouth. Okay? It measures the bone. Okay?
So,
And if the patient is going through a bone loss stage, it doesn't make sense to put them a crown because
There's no support.
yeah, they don't have the support, and they're probably gonna have to lose that tooth. And
So I have a question, Ms. T.
yes,
So can you use the probe before and after the cutting procedure? Like, can you measure it after you do the cut and everything as well?
yes, so you can measure it anytime. So when you're gonna probably come in for your cleanings after we've done the crown and things like that, they should always measure your gums to make sure your gums and your bone to make sure you're not falling into a stage of periodontal disease or bone loss. So we can measure at any given time. It's very important that we do that because, I mean, we can't see the bone, right? We can only see it on x-rays, and that's pretty much it. And measuring it with the probe, and the probe will tell us how much we've lost, or how tall, how short, if that makes sense, by using the probe. So we don't want to steal our patients' money. Of course, we want to give them the best value of what they're actually paying for, but we definitely want to be realistic. And, sometimes it's hard to accept that we are going to lose our teeth, right? And sometimes that's just how it happens for some. Okay, the next one. So once we have cut that, listen, you guys, if this Zoom cuts off, I need everybody to log back in. Okay, we have 7 minutes, so we should be done in time. So right here is your retraction card. Who remembers the retraction card? No one?
Me?
I do.
Okay. Gabby?
so isn't the retraction card, don't you put it like around the tooth and kind of like isolate it from the gum line?
Yes. So you're going to pretty much put it around the tooth. I mean, it doesn't actually show the retraction card, but it would be in a bottle like this. And I will post a picture on what it actually looks like packed around the tooth for you guys. Okay. I actually have all that lined up. So yes, we will pack the retraction card around the tooth to separate the gingival margin from the tooth. Who could tell me why we do that? Anybody can tell me why we place retraction card?
Oh my God. I know.
Mackenzie, Gabby, Chanel, Sharina, anybody? It's okay if you may, it's okay, you can give it an educated guess, or you may think you know, and then you're thinking you don't know, but I think you know.
Is it like
Well, if you're
like to measure it or
if
something?
you're making, yeah, what she said.
It's to go inside the tooth, I guess, to pack it in. Like a
Oh.
seal?
Somewhat. So the card, it's like an actual card. It's kind of like a piece of thread. So what we'll do is we'll take that card, and you know how you floss and that floss slides under the gums that sits on side and inner proximal of the tooth. So the retraction card would actually wrap around that gum, that gingival margin, to separate. We want to pull the gums back from the actual tooth that we cut. Sometimes we don't have to, but to get a really good impression, we want to be able to pull that tissue back to actually see how the tooth is actually cut properly. Because that cut that sits along that gum line is very important for the lab to see, so that when they make that crown, and we place it on the tooth, it'll fit like a glove, like tight, tight, tight. We don't have to worry about that patient having cavities or anything to that nature, if that crown is sucked on tight to that tooth. So the card is in here, you guys, and right here is your, let me see if I can bring it on up a little bit more. Right here is your instrument that you would use to pack that card around the tooth. Okay. Any questions before we move on? Nope. Okay, good. All right, I'm gonna kind of zoom out a little bit to see where I'm at. And I'm going to stop sharing this one, and I'm going to move to the next half of this tray. So let me stop. All right. So now would be the time to ask me any questions. We went through a lot, and I've only heard from a few of you. So I want to just make sure that we are understanding what's happening, what are we actually looking at, things like that. This is not like just listen to me talk. I need everybody. This is like if we were exactly in the lab and everybody was interacting as we would in the lab. Okay.
I have another question, and I
Yes.
never asked you this. So, is a crown need to be put on a tooth if it has not just like a cavity, or if it's broken? Like, could there be multiple reasons that you would need a crown, right?
Yes. So yes and no. So if the tooth is full of decay, when I say decay, that means, I don't know, people call it a rotten tooth. The soft, gooey stuff that would be inside of the tooth. If it's full of decay and we clean the decay out and we don't have a lot of tooth structure left to place a filling, then a crown would be the next step. If a tooth broke in half, of course, if it broke in half, then we can't put a half a filling on the other side, right? So
Right.
we would, the option would be crown. And if you would get, root canal, we know we pretty much open the inside of that tooth, so we have to be able to seal it properly and give that patient a solid tooth back. So it could
Okay.
be multiple reasons why you would need a crown. And some people, if you notice, like, you notice this a lot in celebrities, I guess, because we watch them a lot on TV and social media. It's like you go back to an old picture and you'll see their teeth when they first started, and then you'll see their teeth now, and there's all pearly white and there's like a different shape. 9 times out of 10, they possibly put some type of veneers or crowns on their teeth to give them a better look. And some of them, if you notice, they have too much teeth all of a sudden. Like it's huge teeth, and I don't know, it just doesn't look right to me. But I guess if I was a dentist, I would want them to spend their money with me too, right?
Right.
So it's gonna shut off, and I'm gonna need everyone to log back in, okay?
Okay.
So just let it, do what it does.